here we are very, very lucky that the whole of our team work together, get along very well together, and we work for one single cause, which is to make the patients as good as we can and make their care as good as we can.
We see probably about 110 to 120,000 patients through the emergency department a year. It's what used to be thought of as a big district general hospital. We're big enough to attract all the interesting stuff that you'd want to see in an emergency department, but not so big that we have clashes of personality with the other specialities.
Derby is just a wonderful department. I worked here originally as a registrar. It was my first registrar job. Just the atmosphere around here is so friendly, and you can see that we have the most amazing department physically. It's absolutely beautiful. It's purpose built and designed, new in May 2009.
We've got an excellent reputation for teaching and training. We have the ultrasound lead as one of our consultants. We've just appointed another consultant who's also got a master's in ultrasound, so we're taking the lead regionally for that. We offer paediatric training to the trainees as they're coming through. Derby has just been taken on as one of the sites to offer that.
And one thing that we pride ourselves on is we will give the time to individual trainees to get to where they want to get to.
We've got a very experienced group of consultants, all with different strings to their bow.
I'm an emergency medicine consultant, but as well as that I've done lots of work within acute medicine as well, so I do have an acute medicine interest. Traditionally it would have been you would just solely do emergency medicine, and now there are a whole range of other different areas that you can go into with regard to subspecialty, and that can be paediatrics, it can be intensive care, it can be acute medicine, it can be pre-hospital care, and others will develop over the next few years, I'm sure, to give people a range of interests outside of emergency medicine and be able to continue with those while doing your career as a consultant.
People often say that emergency medicine, family life, long hours doesn't mix. I'd actually like to turn that on its head. Actually
having a family and doing shift work works much better, because when you finish work and you can go home.
Derbyshire's beautiful, absolutely beautiful.
I think the fantastic thing about Derby is that it seems to be 2 hours from everywhere, so you really are sort of middle of the country. You've got the Peak District just on your doorstep. There's fantastic cycling, fantastic walking.
I like the fact that we've got a range of patients coming through the door with a range of different conditions, and that might be medical, it might be surgical, it might be orthopaedic, and the teamwork here is second to none, and I've never been in a team like that before.
Well, I would call it the Derby way. I think it's something that juniors talk about quite a lot. They feel very supportive, they feel very looked after. We are genuinely interested in their career and their life.
It's fast turnover, you can't predict what's going to come in through those doors, and I love that as well. I love the unpredictability. Every day is different, every day I learn something, and we work in such a fantastic, great team. It's always fun.
You've got an opportunity to make a real difference.
It's varied, it's exciting, it's interesting. You'll be able to use all your patient assessment skills in managing patients, ranging from completely well to on death's door. There's nothing else quite like it.